Hello there. When you think about diabetes symptoms, what comes to mind? I'm sure you remember the top three: excessive thirst, frequent urination, and weight loss. And you're right. These three diabetes symptoms were reported since ancient Egypt, 1,500 years before Christ. In this video, I will talk about the top 10 diabetes symptoms. And the earlier we discover that a person has diabetes or prediabetes, the better. Because we can prevent the consequences of diabetes, and if you are pre-diabetic, we can prevent you from becoming diabetic, and I will explain how at the end of the post, so read until the end. Diabetes is a very common disease. The United States has about 40 million pre-diabetics and 13 million diabetics. And we know that 1 in 4 pre-diabetics will become diabetic within 5 years. How many diabetics are there in the United States? As I mentioned, 13 million or more are diabetics, with approximately 1 million having type 1 diabetes and 12 million having type 2 diabetes. What is type 1 diabetes? Type 1 diabetes is an autoimmune disease, where there is destruction of the beta cells in the islets of Langerhans and the pancreas by the body itself. The body attacks its own cells until the pancreas can no longer produce insulin. It can occur at any age but is more common in children and adolescents, with the peak being between 10 to 14 years old. What is type 2 diabetes? Type 2 diabetes, which is the most frequent type, is characterized by insulin resistance, meaning that the tissues in your body become insensitive to insulin. Your cells no longer want insulin. Unlike type 1 diabetes, the pancreas still produces insulin, sometimes even more than normal, but the production is inadequate to prevent hyperglycemia. In the past, type 2 diabetes was commonly seen in older adults, but today, due to widespread obesity, there is a significant increase in children and adolescents being diagnosed with the disease. That's why I emphasize here, obesity is the most important environmental factor for insulin resistance, prediabetes, and type 2 diabetes. What kind of obesity? Mainly abdominal obesity, the visceral type. Subcutaneous fat is less associated with insulin resistance. That's why we see differences between apple and pear obesity. Apple obesity is when fat is mainly located in the abdominal, arm, and neck regions. In pear obesity, fat is deposited in the lower parts of the body and is less harmful. And pay attention. We know that physical exercise modifies the site of fat deposition, as we've seen in Japanese sumo wrestlers. They have a diet of 7,000 calories per day, but because they exercise so much, they rarely have diabetes or triglyceride problems, despite being morbidly obese. Does genetics influence diabetes? Yes, type 2 diabetes, mainly, has a strong genetic component. Studies with identical twins show that if one twin has type 2 diabetes after the age of 40, the other twin has a 70% chance of becoming diabetic within 1 year. Are there differences between the symptoms of type 1 and type 2 diabetes? To some extent. With type 1 diabetes, the body can no longer produce insulin, it produces very little or none at all. This usually results in much higher glucose levels and is a more severe form of diabetes. Therefore, the symptoms are easy to notice. Since it is more common in children, they may start to eat a lot and still lose weight rapidly, wet the bed, something they never did before or had stopped doing and now they can't hold it in, and wet the bed or even their classroom desk, which can be embarrassing for them in front of their classmates. The child becomes more irritable, starts fighting and screaming with others, which is unusual for a previously calm child. They feel very thirsty, and their vision may become blurry. One important thing to note is that type 1 diabetes can cause diabetic ketoacidosis, which is very dangerous and can lead to death. Diabetic ketoacidosis is an acute complication typical of patients with type 1 diabetes and is associated with stressful conditions that lead to increased counter-regulatory hormones, such as during an infection or close to an exam at school. The symptoms of ketoacidosis are different, so pay attention. Sometimes intense abdominal pain, nausea and vomiting, inability to eat, excessive weakness, shortness of breath, rapid breathing, the body trying to get rid of excess acid through breathing, mental confusion, and a fruity smelling breath, smells like rotten apple or other spoiled fruit. If you experience any symptoms, you need to go to the emergency room immediately, where in addition to high blood sugar levels, you may also have high levels of ketones in your urine, hence the term ketoacidosis. What are the signs and symptoms you should pay attention to if you think you may have type 2 diabetes? Sign/symptom 1, dark patches on the skin that form in the folds of the neck, armpits, or groin that may be soft and velvety. The person notices that their neck is dark, tries to scrub it off or use ointment, but it doesn't improve. It's not dirt. It's called acanthosis nigricans, and it's due to excess insulin that your body is producing, causing normal skin cells to reproduce rapidly. For those with dark skin, these new cells have more melanin, which produces the skin patches. So, take a look at your neck. Acanthosis nigricans is a strong predictor of future diabetes. Symptom 2, periodontitis. Periodontitis is a common chronic inflammatory disease characterized by the destruction of the supporting structures of the teeth and is characterized by swelling and redness of the gums, bleeding gums, gum recession, loose teeth, and tooth loss. It has multiple negative impacts on quality of life. Diabetes is a significant risk factor for periodontitis. It is about 3 times more common in people with diabetes. And mind you, the risk of cardiorenal mortality is 3 times higher in diabetics with severe periodontitis than in diabetics without severe periodontitis. So, if you are diabetic or pre-diabetic, take good care of your teeth and gums. Everything in the body is interconnected. Symptom number 3, itching and fungal infections. Excess sugar in the blood and urine provides food for fungi, which can cause infections. Fungal infections tend to occur in warm and moist areas, such as the mouth, genitals, armpits, and groin. The affected areas usually itch, but the person may also feel burning, redness, and pain. Fungi feed on sugar. Keeping blood sugar levels in the normal range can help reduce the risk of infection. Some types of candidiasis can lead to serious complications if left untreated. And a side note, if you have recurrent urinary tract infections, you should check if you have diabetes because diabetes also increases the risk of bacterial infection. Symptom number 4, visual blurring. Visual blurring can occur in people with diabetes. If a person who previously had clear vision now sees things as blurry or unfocused, it may be a symptom of diabetes. Why is that? When a person has high blood sugar levels, the sugar content within the eye also increases, causing water to be drawn in, resulting in the swelling and changing of the shape of the eye's lens. When the shape changes, it results in blurred vision and a lack of focus. Diabetes can also cause darkening of vision if blood sugar levels drop too low, leading to hypoglycemia. But when it comes to vision, diabetes is the leading cause of blindness in adults worldwide due to diabetic retinopathy. Uncontrolled diabetes in the long term damages the small blood vessels at the back of the eye, the retina, and this can cause blurred vision. Symptom number 5, burning feet. Diabetes and prediabetes are the number 1 causes of burning feet. Why? Due to diabetic neuropathy. We know that diabetic neuropathy can affect up to half of all people with diabetes, meaning that almost 7 million Brazilians have diabetic neuropathy. If peripheral nerves are damaged, other organs such as the eyes and kidneys may also be affected. Some diabetics may have mild symptoms, but for others, diabetic neuropathy can be quite painful and disabling. Symptom number 6, fatigue. According to the American Diabetes Association, ADA, 61% of people newly diagnosed with type 2 diabetes feel fatigue as a symptom. It is simply the second most common symptom. Why is that? The cells in your body may not be receiving enough glucose and become energy deprived. But this excessive fatigue can also be due to the diagnosis of diabetes, leading to anxiety, waking up frequently at night to urinate, being overweight, which causes fatigue, and even sleep apnea and snoring. Some diabetes medications, such as metformin, can lead to vitamin B12 deficiency, which is associated with fatigue. Symptom number 7, excessive hunger. Diabetes can make you even hungrier than usual, specifically for sweet, sugary foods. And mind you, diabetic hyperphagia is not the same as binge eating. With binge eating, the person consumes an excessive amount of food, even when not hungry, usually due to an emotional component. In diabetic hyperphagia, the person feels constantly hungry, whether they eat or not. And why do they want to eat sweet foods? Because the cells in the body are not getting the sugar they need. Symptom number 8, excessive thirst. Diabetes causes excessive thirst. When your body cannot process sugar properly, your kidneys will start excreting sugar, and the sugar will pull water with it. This will dehydrate you and cause osmotic diuresis. Your kidneys will produce more urine, which triggers a thirst response that leads you to drink more water. And this thirst is usually accompanied by prolonged mouth dryness. Symptom number 9, unexplained weight loss. This symptom is more common in type I diabetes, where insufficient insulin prevents the body's cells from getting glucose from the blood to use as energy. When this happens, the body starts burning fat and muscles to obtain energy, causing unexplained weight loss. Now, if you are having glucosuria, which is urine with sugar, you can also lose weight because of it. The new diabetes medications, SGLT2 inhibitors, can also cause weight loss for this reason. Symptom number 10, frequent urination. One of the first symptoms of diabetes is the need to urinate more frequently during the day. You will be thirstier, drink more liquids, and wake up more at night to urinate. When there is too much sugar in the blood, which happens if you have diabetes, your kidneys need to work harder to get rid of it. This forces them to produce more urine. And glucosuria, the loss of glucose in the urine, dehydrates you, and makes you drink more liquid, which increases this vicious cycle. But diabetes can also increase the chance of urinary tract infections, which can lead to polyuria. So you see, the symptoms are all interconnected. You're experiencing symptoms of diabetes, now what? How can you confirm if you have diabetes? By taking a blood test. Fasting blood glucose values. Normal fasting blood glucose levels are up to 99 mg/dl. If you're between 100 to 125 mg/dl, you're in the pre-diabetic range. If you're at 126 mg/dl or higher, you have diabetes. But it's not just about fasting blood glucose. Oral glucose tolerance test, 2H. There's the oral glucose tolerance test, where you have to drink that sweet liquid. If it's normal, it's less than 140 mg/dl after 2 hours. If it's between 140 to 199 mg/dl after 2 hours, you're pre-diabetic. If it's 200 mg/dl or higher, you have diabetes. HbA1c. And there's the HbA1c test, which is the average of your blood glucose levels over the past 10 weeks. Normal levels are below 5.7%. Between 5.7% and 6.4% is pre-diabetic, and 6.5% or higher is diabetic. Of course, one test doesn't confirm whether it's diabetes or prediabetes. You have to repeat the test to make sure. Diabetes is a serious condition that affects millions of people around the world. It is important to be aware of the symptoms and to get tested if you think you may have diabetes or are at risk for developing it. Remember, early detection and treatment can make all the difference in managing this disease and preventing complications. If you found this video informative, please consider subscribing to our channel for more educational content on diabetes and other health-related topics. Thank you for watching and taking the time to learn about this important issue. Oral glucose tolerance test, 2H. There's the oral glucose tolerance test, where you have to drink that sweet liquid. If it's normal, it's less than 140 mg/dl after 2 hours. If it's between 140 to 199 mg/dl after 2 hours, you're pre-diabetic. If it's 200 mg/dl or higher, you have diabetes. HbA1c, and there's the HbA1c test, which is the average of your blood glucose levels over the past 10 weeks. Normal levels are below 5.7%. Between 5.7% and 6.4% is pre-diabetic, and 6.5% or higher is diabetic. Of course, one test doesn't confirm whether it's diabetes or prediabetes. You have to repeat the test to make sure. Diabetes is a serious condition that affects millions of people around the world. It is important to be aware of the symptoms and to get tested if you think you may have diabetes or are at risk for developing it. Remember, early detection and treatment can make all the difference in managing this disease and preventing complications. If you found this video informative, please consider subscribing to our channel for more educational content on diabetes and other health-related topics. Thank you for watching and taking the time to learn about this important issue.